Since Nigeria confirmed its first COVID-19 case a little over 100 days ago, the country has rolled out monetary and fiscal measures as well as locked down some of its major cities and most affected states, all in a bid to curtail the spread of the COVID-19 pandemic, with about 8,173 active coronavirus cases in Nigeria. Tilewa Adebajo, the CEO of CFG Advisory, joins me from Lagos to recap Nigeria's COVID-19 strategy and, of course, assess their impact so far. Tilewa, always a pleasure to have you join CNBC Africa for our conversation. So Lagos has seen a major drop in its daily confirmed cases of the coronavirus. 38 confirmed last night as opposed to the all-time high of 378 daily confirmed cases. And this brings to the fore now the desire to obviously assess the gains from the government policies. What are your summative thoughts so far?
Well, I think one of the problems of this data that we're seeing is the fact that it's grossly inadequate in the sense that for the population size of Nigeria, close to 180 million, the level of testing is not sufficient. And it's not sufficient to provide you with the proper statistical data in terms of understanding exactly where we are. So that is the fundamental flaw within that policy. The second flaw within the policy that I see is the fact that every person that is tested positive, whether they're symptomatic or asymptomatic, is being put in an isolation center. And it's clear now that they don't have enough capacity in these isolation centers to cope. And clearly, those are the two flaws we see in that strategy. They're now beginning to change the strategy in terms of putting people to treat themselves at home.
So, Tilewa, clearly, if I heard you correctly there, your summative response was that so far Nigeria's response has been grossly inadequate. Now we've had a series of responses, of course, from Nigeria, a few of them surprise responses, if I could safely call them that. One of them was the MPC's surprise rate cuts, and also that we've seen the continued easing of the COVID-19 restrictions, including plans, of course, to resume interstate movement and domestic air travel as from June the 21st this month. Now, Tilewa, amid talks of an expected second wave of the COVID-19 pandemic, is Nigeria opening up its economy too early?
Well, I really don't know where the science is in Nigeria, because to be honest with you, I think there's something that is quite unique with this population that hasn't been explained by science. We're not quite sure with the fact that we're not seeing a lot of fatalities. But one of the things you can point to very quickly is the demographics of Nigeria, in the sense that 80% of the population, I think, is below like 35 years old. And I think that gives you a significant offer for this whole disease or this virus. The other side of this is the fact that we have been used to malaria and fever treatment here in this country. So people are able to deal with fevers very easily. But having said that, I think there's still something that we're still not able to explain from a scientific basis, which is keeping a lot of our fatalities low. And the testing and the science clearly it does not provide the sort of data that is required to make those decisions. But having said that, I think by default, I think the strategy of the government by default is now to take a look at herd immunity, because that's the only way I can see to explain all these issues. Because if you take a look at what is going on in these so-called isolation centers, all they're doing in the isolation centers is conducting clinical trials. And the whole essence of the program, I think I cannot see the science, so I cannot see the logic that is making things happen. So having said that, I think opening up the economy, I think it's been open a bit for some time now, and we have not seen significant deaths. I think that is the way, unfortunately, we have to measure this. And if we have not seen those significant deaths, then I think that there is something else that we all need to look at. And I think that by default, the strategy is herd immunity. And obviously, yes, everything will open up at the end of the month. And if there's any other problems after that, then I think we'll reassess the situation at that point in time. And if need be, I think then we'll